Foster care and children's mental health funding has been grossly underfunded for decades. Is there any hope that these will get legislative attention and fiscal relief?
Well, it's a great question, and it's a subject area that's near and dear to my heart. I've sat on the budget subcommittee, 3 on health and human services. It has the reputation of the longest hearings of any subcommittee, and it's because we deal with foster care, with the developmentally disabled, with people trying to survive on Medi-Cal and disability payments at below poverty line, at half of the poverty line. The campaign has been to bring people living with disabilities up to the federal poverty line in terms of what we're providing in the way of support for housing, medical care, monthly stipends, etc. It's tragic to see people who wait in the halls in Sacramento for hours in wheelchairs, often with attendants, often dependent on an interpreter, not language interpretation, but people who can't enunciate, can't articulate words, and have to have an aide working with them to testify in front of one of our committees. And I'm going to be partisan here for a moment. I think it's outrageous that Republican members of this committee leave after an hour, and the other members of the committee, we stay there till 6 at night, 7 at night, 8 at night, 9 at night on Thursdays. The Capitol cleans out on Thursday afternoon. These issues are heard on Thursday afternoons.
What does that mean, these issues? It's specific to children?
Foster care children, people living with disabilities. So they have very good advocates. But those advocates, it's a labor of love. Those advocates don't have the resources to retain the highest paid lobbyists. So if you want to see legislators getting wined and dined, follow the money. See who's Chevron. No offense to Chevron, but I'll say it. They throw their money around like there's no tomorrow, and that translates into campaign contributions, oil, tobacco, alcohol. That's the big money that's distracting people from what I think are the human necessities. The disabled, the foster youth and foster parents, they are strong advocates on the issues. They don't make campaign contributions.
No.
That committee is not considered a juice committee. I don't get a single contribution from anybody for my work on that committee, but it's some of the most important work from a human rights, from a quality of life. And I think my hope is that Governor Newsom and his wife will be a team in looking not only at early childhood education, but at foster youth and the related issues. The mental health link is also critical. Our county jails are now holding centers for the mentally ill because we don't have sufficient infrastructure in mental health services. So people get picked up and they end up in a county jail, and we know the tragedies that have happened locally with that combination of incarceration and mental illness. Our state prisons are full of people that are mentally ill, and our homeless population, people that are mentally ill. We need more investment in mental health services. That's where Darrell Steinberg, his leadership to create the millionaire tax, the 1% tax on millionaires that funds the Mental Health Resources Act, Mental Health Services Act, was Prop 63 a number of years ago. And some of that money has found its way to counties, but not into programs, whether it's housing or mental health services. That's why we repurposed it. And you supported it with Proposition 2 to repurpose some of that Mental Health Services Act money to make sure it gets to the community that needs the help. But this is an area where it takes a village. Families who have a child with a physical disability, a mental disability, a mental health diagnosis, they don't have the resources to do it alone. And we as a society need to prioritize the human need. And people will say that this is not a fair comparison. You know how much we're going to spend to modernize our nuclear weapons? at the federal level, $1.3 trillion under the current administration to modernize our nuclear weapons. A quarter of that could fund mental health services in every state in this nation. And what are we going to use a nuclear weapon for when the biggest threat to us are terrorist organizations that have no national identity? If you want to get the best bang for your buck in military terms, it's intelligence, and it's the ability to protect. A nuclear weapon, who are you going to use a nuclear weapon against? We're going to spend $1.3 trillion, and people say, well, that's apples and oranges. It's our tax money. It's our national debt. We need to raise a voice that says, no, let's invest that in the mental health of our communities, the education of our children, the health care of our communities. And if we did that, and that was how our foreign policy money was invested, we would reduce the basis that creates conflict in the first place.
Mm-hmm.